webinar on the National Public Health Week, our second webinar on the physical activity webinar series. And today we're gonna have a webinar on physical activity for older adults. And I really welcome you. And for those who have been here yesterday, you know already how this webinar basically works. So this webinar is organized in collaboration with the Florida International University. It's basically set up by the American Public Health Association, the physical activity section. It's also collaborating with the Universidad de Antioquia and Medellin, Colombia, and America's Network for Chronic Disease Prevention. So it's a pleasure to have here also Dr. Richards. And before I give you the word, they're gonna give a small presentation about physical activity in older adults, what we know of the tendency in the United States. So that physical activity is beneficial for health is nothing new. We knew it already, we know it since many thousand years. So Hippocrates, he mentioned that if he could give every individual the right amount of nourishment and exercise, not too little, not too much, we would have found the safest way to health. But the problem, as we know, is how to apply that and how to be physically more active throughout the entire lifespan. This is the current situation we have in the US with the percentage of the population aged 65 and older who reported doing no physical activity or exercise other than the regular job in the past 30 days. So we can see that we definitely have a problem. I mean, the darker the screen gets, the map, the worse the situation is. And you can see more in the eastern part of the country, the situation is worse. A lot of states there where sedentarism is more than 35% in older adults. Besides part like California, we do a little bit better, but still, even if you have 20-25% of the adult population, older adult population, physically inactive, it's a problem. And there's a lot of things that has to be done in order to make everybody, specifically the older adults, to move. These are basic recommendations for older adults, and I'm sure Dr. Richards, she's gonna explain more details. What does it mean? We see here, this is like the recommendation throughout the whole life cycle. We see that for older adults, the specifications are a little bit even more precise, that they need a little bit more, not only reaching the regular 150 minutes of moderate intensity physical activity, but they have to do a little bit more. And I'm sure Dr. Richard will tell you a little bit, give you more information or insight into that. So we have a challenge, and we know basically that the benefits of physical activity in older adults, we know it improves sleeps, to maintain healthy weight, helps to manage stress, improves quality of life. And there's also enough scientific evidence that we can decrease most of the chronic diseases like type 2 diabetes, cardiovascular disease, even falls in depression and back pain and several cancers by reaching the recommended amount of physical activity. So some is good, more is better in regard to physical activity, but important is that you make a start today. It's never too late to be physically active. And importantly, every minute counts. So you can get the physical activity benefits from wherever you'd like to take them. And with this, basically, it's a pleasure for me to present you our speaker of today, Dr. Libby Richards. She's an associate professor and PhD program director at Purdue University School of Nursing. Her research explores individual and interpersonal influence of physical activity. And as a public health nurse, Dr. Richards widely disseminates health promotion education and has reached audience through print sources such as CNN, ABC News, the Wall Street Journal, and the Washington Post. But most importantly, she's a friend, and she's a past president of our physical activity section. This makes her a very special person, not only for me, for the entire physical activity section. Libby, they're all yours. Thank you very much for joining the webinar and accepting our invitation.
Thank you so much for the opportunity. I could talk about this topic every minute of the day. So there are certainly things that I want to share with you, but I do want to thank you very, very much for this invitation and for helping us celebrate National Public Health Week. So let's start by talking about everybody's favorite topic, aging. We know that 1 out of 4 65-year-olds today will live past the age of 90, and those are just averages. So 1 out of 10 will live past the age of 95. Aging is inevitable, and our population is aging at quite a fast rate. But what we want to do is age well. And so I refer to that as vital longevity or healthy aging. So you may think that aging is out of your control. But the truth is, aging is impacted by a multitude of factors, including our genes and our environment. But our lifestyle also has a very big impact on aging. And that's what we're going to spend some time talking about today, specifically physical activity. So we know that aging, it's going to happen. It happens to all of us. But being physically active is essential to healthy aging, which is the type of aging we all want to do. And I don't like to often refer to as exercise because some people have a negative connotation with exercise. They might think about getting sweaty or having to go to a gym or buy special equipment. So the things that we're going to talk about are, I phrase them as physical activity, things that we likely are already doing, but we could do more of, or we could do differently to get even more benefits. But the messages I'm going to share are clear, that physical activity can delay, prevent, or manage many debilitating chronic diseases and also reduce the risk of premature death. Being regularly active can increase our physical strength, especially for older adults who are physically active. It helps build and maintain healthy bones, muscles, and joints. You may also be more secure and stable on your feet, which can reduce the risk of falls and injuries related to falling. Being active helps maintain a healthy weight. We know that increased weight is a factor in a number of health problems, and physical activity can help keep our weight at a healthy level. And the fact is, if we lose weight by diet alone, we are likely not only losing fat mass, but also losing muscle mass and bone mass, which is critical to healthy aging. So physical activity can help maintain muscle strength, muscle mass, and bone in the presence of weight loss. This is one of my current major motivators for being physically active, is it helps with sleep. When you're physically active on a regular basis, you're going to enjoy better quality sleep. And being active also can reduce feelings of fatigue and being tired during the day. Regular physical activity also reduces arthritic disability. So we know that adults who have arthritis and osteoarthritis have less pain and more flexibility when they are regularly active. It's also clear that physical activity helps our heart work more efficiently. Aerobic activity, in particular, the kind that makes us breathe faster, can improve the fitness of our heart in as little as 6 weeks after we become regularly active. So that's a pretty quick return on investment. Being active also improves our blood sugar control. Better control of our blood sugar means that we may need less medication or no medication at all if we have diabetes, and can also reduce the risk of long-term complications associated with diabetes. Physical activity keeps our bones strong, and this is especially important for women as we age, because after menopause, we start to lose bone mass. And the good news is physical activity and strength training exercises can increase and maintain our bone density. Exercise reduces the risk of several chronic illnesses, some including diabetes, stroke, heart attack, high blood pressure, breast cancer, colon cancer, high cholesterol. And not only that, it reduces the risk of many other cancers and chronic diseases. But it gets better, because being physically active also saves us money. So adults and older adults who are regularly active have lower medical costs in general, which is not only good for us as individuals, but it's really good for our society and for public health. So I'm hoping what you hear is that physical activity is literally the closest thing to a fountain of youth that we are ever going to see. And it is essential for healthy aging. But the good news continues, because it's not just about physical health. Physical activity also promotes mental and cognitive health. Being regularly active can reduce feelings of depression and anxiety, and it also helps the release of feel-good brain chemicals, which can lift our spirits as well. And it also helps keep our mind sharp. Regular activity optimizes our cognitive function, which is essential for independent living, especially in later life. It keeps getting better because the health benefits of physical activity are independent of risk factors. So for example, smokers who increase their physical activity will experience health benefits even if they continue to smoke. Now, I'm not saying it's okay to smoke or it's a good idea, but what I am saying is that is how powerful an active lifestyle is. Likewise, overweight or obese adults benefit from physical activity even if they do not lose weight. Regular physical activity most days of the week improves health and quality of life, bottom line. People at all levels of fitness benefit from increased physical activity. And the benefit of physical activity is proportional to the intensity of the exercise and to your level of fitness when you begin your physical activity routine. In fact, this could be a motivator. The biggest gains are often seen from the smallest increases in physical activity when we go from not being active to start being active. We can really recognize tremendous health benefits and health gains from small changes when we begin that routine. And then the more we do, the more rewards that we get. So what are we talking about here? One point that I want to make clear is no matter what your age or abilities, it's never too late to start being physically active or to get back into the routine of being active. Being active is one of the best things we can do to maintain or improve our health. Activity helps us feel better mentally and physically. It helps us stay strong. It helps prevent falls, and it helps maintain our independence for as long as possible. So Noël had alluded to what this looks like, but older adults and adults in general are recommended to get at least 30 minutes of moderate intensity aerobic activity at least 5 days a week. So this equates to 150 minutes of moderate activity a week, or 75 minutes of higher intensity aerobic activity a week. In addition, we need to incorporate muscle strengthening activity 2 days a week and balance training, ideally 3 days a week. And I know it sounds like a lot, but we can gradually build up to this. And we can often combine some of these exercises to dual count. So for example, dancing could count as a balance activity and moderate intensity activity. So we can, there's creative ways that we can fit this in. But don't be discouraged if you feel like 150 minutes seems too daunting, like there's no way, because small amounts are helpful, and we're more likely to be successful with behavior change if we set smaller stepwise goals. Increasing our physical activity by a little amount every week for a few weeks, then reevaluating where you're at and set your goal a little bit higher. By making these small, consistent changes, we can get to meeting physical activity guidelines. So some is better than none, but more is better. So whenever I'm talking about physical activity, I like to encourage my participants or my audience members to stand up. So I have been giving this presentation standing up, but if you are in a position to stand up right now, feel free, shake it out a little bit, because later on this afternoon, we're going to talk about sitting and why we should not be doing it. But first, let's talk about what do we mean by moderate intensity physical activity. So this is activity that tends to increase our heart rate some, increase the rate that we breathe. It's equated to walking about 100 steps in 1 minute. And there's lots of things that we could do on a daily basis or do more of on a daily basis to incorporate moderate intensity activity. The weather's getting nicer in most of these areas. We can start gardening, walking briskly, bicycling, pushing a stroller, swimming. Hopefully we aren't snow shoveling anymore. Taking the stairs are all ways to add this type of aerobic activity. So if moderate activity right now seems like too much to tackle, the good news is all forms of movement are healthy and provide health benefits. So I want to give a nod to light intensity activity. So light intensity activity are those that require us to stand up, require us to move around in whatever setting that we are in. So using a standing workstation if you have it, breaking up periods of sitting by doing light housework. I've got children at home still, so there's never a shortage of things that need to be cleaned. Less intense types of gardening or any type of hobby that it has us active. Slow walking, casual walking, fishing, yoga, and so forth. Because the research shows that light intensity activity also has and provides major health benefits. And there's a dose-response relationship, meaning the more we do, the better the benefits, likely because light intensity activity tends to replace sedentary behavior, which we need to avoid. So for some examples, for every extra hour of light intensity activity that are accumulated, we have studies that clearly show reduced risk of heart attack. We also show reduced risks of suffering any type of cardiovascular event, including stroke. And another thing that's really important is light intensity activity can help us digest fats and sugars after a meal. So while it might be our habit to have a meal and then maybe sit down and watch a show, what we should be doing, in fact, is have a meal, stand up, either clean up the kitchen or go for a walk. And it can be a short walk because the light intensity activity helps us in our digestion. So as we've said, some physical activity is good, more is better. We need to encourage people to move more, including increasing light intensity activity, moderate intensity activity, and breaking up long periods of sitting. Sitting for long stretches of a time is directly linked to obesity, diabetes, and heart disease. And physical inactivity is estimated to contribute to over 3 million preventable deaths worldwide each year, and is the 4th leading cause of death from a non-communicable disease, and is responsible for many, many cases of colon cancer, breast cancer. Being physically active can reduce cancer. That's very powerful. I do want to take a moment, though, to share with you why sitting is so bad. So when we talk about physical activity, we also talk about sedentary behavior. So this is behavior such as sitting, and a sedentary lifestyle is one of the most detrimental health exposures that we face on a daily basis. In fact, in America, most of us spend more time sitting than we do sleeping. And sleeping is a restorative, healthy behavior. Sitting, not at all. When we sit for long periods of time, we start to experience wasting of our large muscles, such as muscles in our legs and in our lower back, muscles that are critical for stability and for posture and for safety when we walk, for balance. So when we're sitting for long periods of time, we can actually start increasing the risk of falls and fall-related injuries. We also can start to notice stiffness in our neck and in our shoulders. We also know that that sedentary behavior and sitting is associated with increase in weight and also with impairing, as I mentioned, digestion after a meal. We are also starting to see relationships with increased sitting time and mental health. So there are plenty of studies that are showing the more we sit, the more likely we are to report higher rates of anxiety and depression and lower cognitive function. We're also seeing independent relationships with sitting and cancer and other chronic diseases. And it gets worse because sitting is also related to impaired vasculature. So when we sit more, we are more likely to have varicose veins, spider veins. We increase our chance of clots and deep vein thrombosis, many things that we don't want to mess with and that we can reduce our risk of just by standing up and by moving more. But there's good news. You don't need to join a gym unless you want to. Joining a gym to increase your physical activity is a great strategy, but it's not for everybody. And so I want to end by sharing some tips of things that we can do every day that don't require special equipment, don't require a gym membership, just require a small amount of planning and some effort. So when we talk about increasing our light intensity activity and decreasing our sitting, one way we can do that is if we're driving somewhere, park farther away. We can also take more water breaks and breaks while we're at work or while we're sitting. People who are active at work are actually more productive in the long run. So if any of you are employers right now and you hear me say take more breaks, it's actually very beneficial for our employees to take breaks and be active throughout the day. If you're watching a show on TV, stand up during the commercials if you still watch commercials, or stand while you're on the phone. If you're making a phone call, stand up, or even just walk around the house while you're on the phone instead of sitting. There's also lots of community activities that are reemerging that we can participate in to increase activity. If you have grandchildren or neighborhood children, actively play with them instead of doing your mutual activities in front of screens. If you're watching sporting events, especially high school or youth soccer, walk the sidelines instead of sitting and watching the game. If you're not able to have a standing desk, you can engineer your own type of standing workstation by putting a laptop or other device on top of a box on your desk, for example. Take a walking break every time you get thirsty at work. I drink a ton of water at work, but I have one small cup that I use. And when it's empty, I hit the break room and fill it up. So my colleagues see me moving around the building at all times. I also try not to send emails. I try to seek people out instead of, especially if they're in my building, I will walk to their office and try to speak with them that way instead of sending an email. But no matter what your age, it's never too late to start being active or to get back into a physically active routine. Being active is one of the best things that we can do to maintain and improve our health. It helps us stay strong, it helps us prevent falls, and it helps us maintain our independence for as long as possible. Just a few references. And I am happy to defer to Noël if we have time for questions or anything like that. Thank you so much.
Thank you very much, Libby, for an excellent presentation, very well summarized, and a lot of probably thoughts also to, a lot of ideas to think about how to become more active. Let me see the questions. There's one question from Roberto. He asked, Dr. Richards, how does standing make an impact compared to sitting? Ultimately, aren't you still in the same place instead of walking to increase heart rate?
So when we're standing, we are engaging our muscles. So standing automatically requires us to engage our core muscles. Standing also engages the skeletal muscles in our legs. And when we engage those skeletal muscles, it's like squeezing our blood vessels. So it helps move our blood back up to our heart. When we're sitting, that blood is pooling and not circulating as efficiency. So even if we don't physically go anywhere, standing engages our muscles and burns calories more than sitting does.
Thank you. I have a question to you, Libby. Yes, in the last 2-3 years, probably due to the pandemics, a lot of people became more inactive. And I think it probably maybe in affect older adults a bit more as their main probably physicality. One of the things probably is walking, going outside, and it has to be a bit more difficult also due to the fears of getting an infection. So what would be your best advice to older adults how to how to start again and what they can do in their daily lives?
So it's very clear that being outside now, especially when you're not close to others, is a COVID safe activity. And so outdoor walking is the main activity that I try to encourage my patients and those I interact with, because not only are we getting health benefits from being physically active, we're also able to connect with nature. Even if you're in a city, the fresh air, seeing different sights, it's socially stimulating. And so when we are active outside, we get double benefits that we get from nature or we get from social interaction in addition to physical activity.
Thank you. A follow-up question to that. I heard a lot of time some patients that they claim that they can't go for a walk because they have joint pains and they're not able to walk long distances. Mm-hmm. So what could be alternative physiotherapy forms specifically for people who have made problems in walking or running?
Absolutely. So one of the things that we could start with is standing up and standing up often. And also, even when we're sitting, doing what we call like chair marches. So moving your legs up and down is very helpful and can also help break up that inactivity. And while I understand what it feels like to have joint pain, I unfortunately have some arthritis in my hip, and it is painful to start, but it's less painful once I keep going. So even 5 minutes or 10 minutes of standing and walking around your house and doing that consistently multiple times a day can help get you to the next level.
Thank you. And my last question, as there are no question moment from the audience, is you think in regard to the public health point of view, health policy point of view, should there be different interventions for older adults, trying to help them on a population level to be more active, or should be different guidelines? We have guidelines that would be more active, but should there be some specific programs, intervention targeting specifically older adults? As we've seen that we have 3 out of 10 older adults are basically physically inactive in their leisure time.
So there are programs that are available through Medicare that allow older adults access to fitness facilities. And I don't think the uptake is that good on those programs. And so that is something that could be promoted more. I also think focusing on the walkability of environments is critical, because we know that if people don't have somewhere to walk to or somehow to walk safely outside, they are less likely to participate in that behavior. And so from a large scale focusing on walking safety and walkability is very important.
Thank you very much, Libby. I would like to ask if anyone in the audience participants has another question. I also hope that you're gonna join us for tomorrow's webinar and the next of the week. We still have 3 important topics to cover this week for the lunchtime webinars. So I would like to thank Dr. Richards for her excellent presentation and for everybody helping us setting this up. And the webinar is recorded, and we're gonna disseminate the recordings a couple of weeks probably after the webinar series. So for those of you who couldn't attend, if your friends who couldn't attend, you feel free to forward them the link of this webinar. Thank you very much and have a wonderful afternoon, and see you hopefully tomorrow at the same time, same place.
Thank you.